All right, it looks like we've got a fair amount of people that have started to join us, so I'm going to go ahead and start the program here. Good afternoon or morning, depending on where you're joining from. This is Becky from Kleer, and we're so glad to join my social practice in presenting Showing Empathy to Patients as the COVID Crisis Lifts, Membership Plans, and Social Media. All callers are on mute and will remain on mute during the presentation, but send us your questions using the chat or Q&A feature in the Zoom platform, and we'll make sure we address them during the last 15 minutes or so of the presentation. Today, we have two phenomenal experts on the line today. I'm going to take a moment to introduce them to you, and then I'll go ahead and hand things over to them to get the presentation started. So first, you'll hear from Dave Monahan. Dave is the CEO of Kleer, a cloud-based platform that enables dentists to easily create their own membership plan and offer it directly to their patients. Kleer eliminates the costs and hassles of insurance middlemen, making it easy for patients to get the comprehensive dental care they want while enabling dental practices to increase patient loyalty, visits, and treatment acceptance. Dave has a passion for creating technology-enabled businesses that improve people's lives. He founded Kleer and championed its mission from the beginning. He designed the Kleer platform based on dentist and patient feedback, curated a passionate and hardworking team, publicly advocates for dentists and patient rights, and continuously pushes the company to innovate and be better. Prior to joining Kleer, Dave served as the CEO of FitLinks, where he created simple and affordable wearable devices that enabled patients to monitor and manage chronic conditions and athletes to monitor and improve their performance. He also worked at Microsoft from 1999 to 2006, where he developed and implemented new product, market, and partnering strategies that helped the company and thousands of its partners grow and improve profitability. Dave received his Bachelor of Science in Mechanical Engineering from the Pennsylvania State University and an MBA in International Business from Loyola University. Dave is married, has 3 children, and resides in the greater Philadelphia area. Also today, we have Blake Hadley. Blake is partner and founder of My Social Practice. He's a graduate of the advertising program at Brigham Young University and has won a number of national and international awards in art direction, advertising, and creative marketing strategy. He is passionate about helping dental practices use out-of-the-box thinking to create stories that spread on social media. Over the past 10 or more years in the dental industry, he has helped thousands of practices grow and thrive through social media marketing. And with that being said, Dave and Blake, it's awesome to have you both on the line today. And I'm excited for our listeners to learn how to meet their patients with empathy using membership plans and social media. Dave, I'm going to let you take it from here.
Thanks, Becky, for the nice intro. Yeah, I'm going to jump right in. Blake and I are each going to spend about 20 minutes going through each of our content. And then, like Becky was saying, we'll have 10 or 15 minutes for Q&A at the end. I probably have 40 minutes of content here, so I'm going to move through it pretty quickly. And basically what I want to do is talk about the expectations of the patient mindset coming out of COVID and what you can expect, from membership plan and the results you can get, how they work, and then also some best practices if you're going to implement a membership plan. And what we're really trying to get to, you're going to see a lot of data and information here. We're trying to get into that mindset of the patient so that we can meet them where they are and have empathy for what they've gone through. So let's just start with that as a sort of a starting point, the mindset of the COVID-19 patient. So you've probably seen a lot of this data sort of floating around, but what we tried to do is go back to the Great Recession of 2008 and 2009 and try to do a sort of a comparison because it's probably it's the most recent sort of crisis we've had that compares in any way to COVID-19. There's differences, but there's a lot of overlaps as well. But here's, obviously a big deal around COVID is how many people are losing their jobs. And as of yesterday, it's 36.5 million. And through the whole Great Recession, there was 8.7 million jobs lost. And if you went through the Great Recession back in 2008, 2009, you know how painful that was, and how many people were struggling post-recession. So just think about the impact of this 4x sort of multiple job losses relative to the Great Recession. So it's a major impact, right? It's sort of the net of it. I know people know that, but I'm not sure if you've seen sort of taken a step back and compare it to the Great Recession, see how much bigger of a job loss sort of issue we're dealing with. So what we're expecting coming out of COVID is about 50% of all patients are not going to have dental coverage. And so you have, prior to COVID, you had about 100 million US adults without dental benefits. And if you add, like I said, right now it's at 36 million, that's going to settle in, it's obviously going to drop from there as, businesses start to open up, but we can expect roughly 30 million more people are going to either have job losses or benefit losses. So you're talking about, when you do the calculations of how many people are coming into the dental practice, about half of those patients now are not going to have dental insurance or dental benefits. So, and that graph just shows over time the coverage by age group. So prior to COVID, only 33% of people 65 and over had dental benefits, and it was 66% of age 19 to 64. And what is going to get impacted, obviously, is that blue line. That's going to go down post-COVID. Here's the good news. When you take a look at the Great Recession data and how it had the impact it had on dental practices, actually, there's a very slight impact, a drop in 6% of the population that actually went to dental practices before and then after the Great Recession. So this gray area is the Great Recession, and this blue line is the percentage of the population that went to a dentist. And you can see it dropped. It was like 41 back here in 2003. It was sort of leveling off there, and then it dropped a little bit, and it came out of the recession at 38.4. That's a drop of 6%. So not a major impact. And people are usually surprised by it did not have that big of an impact on dental visits. And by the way, anecdotally, we talk to dental practices all the time. Actually, was just on a call this morning, and it seems like what I'm hearing from the dentists is, as the practices are open up right now, they're very busy, and patients are coming back, and the practices are going to have to do things like open on weekends and so on to manage the demand. So early on, but we're seeing something similar here right now coming out of COVID. Now, the thing though that you really need to take into account is the Great Recession did have an impact on cost. So cost barriers as a reason not to go to the dentist. So I know there's a lot of lines here, but just focusing up on the purple and the light blue and the dark blue lines, these are the working age adults. And what it's showing is, basically they surveyed the working age adults and asked them what was keeping you from going to the dentist, during this time period, all the way from prior to the Great Recession and post the Great Recession. And the biggest issue inside the Great Recession was the cost barrier. And that's, it makes sense, right? But the thing to look at is the amount of the impact. So basically, cost as a barrier to getting care increased anywhere between 33 and 50% during the Great Recession. And that's this big jump here. And we're going to see something very similar, as we come out of COVID. It's one of the biggest things on the patient's mind is going to be cost. So what can you expect? So trying to get into the patient mindset and, to have some empathy for patients as they're coming back to your practice. The one thing, which is different than the Great Recession is this treatment backlog, right? So your office has been closed. There's a set of treatment that needs to be done that was not done during that time. Now you have this backlog, and the patients, a number of patients are going to want to come in as soon as possible. I know everybody's putting plans together to manage that, but that's obviously something that's very different from the Great Recession. But similar to the Great Recession, we're going to see a reduced number of patients with insurance, and we're also going to see that pressure on the cash paying patients where they have a lot of cost sensitivity. So basically what we need to do is understand that uninsured patient's mindset and make them comfortable purchasing care. That's sort of the goal right now, is to make sure you understand that. And when you think about, like I said, the average about an average practicing at about 50% uninsured, this is a big impact on your practice. So you need to make sure you understand it. So what I'm going to shift into now is, we did a lot of market research into uninsured patients. And we actually did this research about 2 or 3 years ago as we were setting up Kleer to really understand how we sort of, make sure we meet uninsured patients where they are. And this is really getting emphasized. This research is becoming more important as COVID sort of starts to, we start to come out of the COVID crisis. So one thing to keep in mind is uninsured patients really value oral health. So they have a strong tie between things like their oral health and how their overall health is, between their oral health and how they, how they consider their quality of life, and then also, the longevity and how long they live. So if you think about that, they tie oral health to overall health, quality of life, and how long they live. There's a huge value proposition around oral health, and your uninsured patients get it. And you can see the percentages of those uninsured patients that sort of align oral health to these different things. but they don't come in, right? So this is data prior to COVID, and it goes back a little while. It hasn't changed much year over year. But if a patient has insurance, so that's these bars over here, they come in, about half of those patients will come in on an annual basis. So, and that's pretty bad. I mean, obviously it's another problem to solve, which is uninsured patients not coming in. But the net is about 50% of insured patients come in on an annual basis. That drops to 17% of uninsured patients come in. So they're coming in almost 3 times less than insured patients. And my guess is this is only going to get worse due to job losses and benefit losses post-COVID. And we did, part of the market research we did a national survey of thousands of uninsured patients, and by far the most important things to them are cost and coverage as the reasons they stay away. And I mentioned, earlier I went through, the Great Recession, the impact it had on patient visits, and the cost as a barrier. Again, these things are going to get emphasized and become a bigger deal even, post-COVID than they were prior to COVID, which is this data. So about 70% of uninsured patients say the reason they don't come in is it's too expensive and I don't have insurance. And they're very tied together, by the way. There's a tight couple between the two. And one of the big sort of couples between them is it's not really that it's too expensive. It's that these patients don't understand how much things cost. So it's really hard for them to get hold of cost data that they can rely upon. So they basically are afraid of costs and they assume the worst. So we would do one-on-one interviews with these patients to try to understand, what do you mean by too expensive? And what it became very clear is it was just, I don't know how much it costs, so I'm assuming the worst. And a typical answer on, like, we'd ask them, how much is a cleaning? How much is, a x-ray and so on? How much is a filling? They typically guess 2 to 4 times higher than the actual costs. And so there's an absence of understanding of costs is the big issue. And so now this is the side where you really want to take a step back, because this is exactly what we saw in our research. And this is based on talking to these patients and understanding them. If they're sitting in that chair and they're uninsured, sort of what's their mindset? And so here's the things they told us. They're very worried about the cost of care. I already mentioned that, right? That's the biggest reason they stay away. So just think about it. That's why they stay away. So when they do come in, that's a big deal. They hate not having coverage. They feel bad about themselves for not having coverage. They know a lot of other people have coverage and they do not. So that just makes them feel bad. They have no way of determining a good price. And I mentioned that, and that's a big deal. They always believe they're paying too much no matter what, because they have no reference, right? And they're not getting a deal, quote unquote. So they feel like you put yourself in that position, you always feel like you're sort of getting ripped off, you're paying too much. And they're not going to negotiate fees. You probably have a handful of patients that will try to negotiate, but by and large, uninsured patients are very uncomfortable negotiating fees in a healthcare setting. It's not what they try to do, because they feel like your quality of care is going to drop. You're going to think less of them and maybe not provide the level of quick care they think they should get if they're not negotiating. So the net is the overall feeling they described to us was this feeling of being exposed when they're in that chair. And that face of that patient in this image, I think, sort of captures that perfectly. So that's sort of, what, if you want to try to get into the shoes of an uninsured patient, that's it. And like I said, with COVID and some of the things that are happening, not just with job losses and benefit losses, but also the little bit of a fear of the future, right? And some insecurity about the future, all these feelings are going to get even more reinforced. And so trying to relate it to something you might have dealt with, I've dealt with this, like, how does it feel, right, when you go to the mechanic and they mention you need to replace some part? You don't even know what the part is or what it does. You have no idea how much it costs. You don't know the mechanic's skill set and putting that in and whether he's the right person to do it. So you're faced with a decision, and the outcome of this decision, either outcome is a bad one. So one is you accept their diagnosis and you get it done, and you feel like, I had no idea whether I should have done it. I don't know if I paid the right price. I don't even know if I needed it. But you end up getting done. You sort of capitulate and just get it done. And the other feeling is I say no and I leave, and there's this thing hanging over you now. Should I be getting it done? Is my car going to break down? I have to deal with this now down the road at some point. And that feeling of not completing something is a problem down the road. So either option is not good. And that's very similar to that sort of feeling your uninsured patients have. The great news about your uninsured patients is they want coverage. So this is based on a national survey we completed of thousands of uninsured patients. 89% expressed an interest in dental coverage. And you can see the sort of the whatever spectrum of interest, but the most important part of this is this level of extremely and very interested. It's about 50% of the uninsured patients. but they did have caveats. They wanted it to be simple, transparent, and affordable. They don't want some complex plan. They don't want insurance. They've looked at insurance. They think it's way too complex. And in the words of one of the patients we interviewed, they basically say, I know the insurance plan is going to get me somewhere down the road, right? Because it's 10 pages, it's got all kinds of caveats, it's got small print, it's got deductibles, it's got waiting periods, and so on and so forth. And that's what they do not want. They want something that's simple and transparent. So what, some sort of reference points for you as you think about a membership plan is a couple books here, The Membership Economy, The Automatic Customer. Really good books. They were written a while ago, but they talk about subscription businesses across all industries, not dental. Actually, I think when they wrote these books, there really wasn't any subscription in dental, so I don't think it's mentioned in the books. But what they basically are saying in these books is this membership economy, subscription sort of businesses are really good fits for repeat business from customers who have other options. And if you think about dental, it doesn't much more align to that, right? You got repeat business, every 6 months or so, and even more than that at times. And they have other options. There's a number of dental practices out there they can pick and choose from. And then what you're trying to do with a membership, the way you create value is you create a long-term mutually beneficial relationship. So the member gets access to products and services that are in a more simple, convenient way, right? Building trust and commitment. And then on the company side, what they see is averages across all these different industries that they measured. You can go read these books and see the analysis they've done, is that customers who are a part of a subscription or membership purchase twice as much as customers that are not. And here's some examples of memberships I have, and you might have some of these, you might have others, and you think about, how has this changed my behavior? And I can go through each one of these, but the one I typically will pick out is Prime and how that's changed my purchasing habits. And I'm sure, a lot of people in this webinar say the same thing. Like, I don't even think about it anymore. I just buy from Prime. And I would say 80% of my purchases come from Prime. And it's changed my behavior in that now I'll do things where if I'm going to do something over the weekend, I'll order it on Tuesday or Wednesday. It's at my house on Thursday or Friday, and I'm off and running versus trying to run out and find something over the weekend. One thing I always sort of ask people is, have you ever actually checked prices on Prime versus other outlets? And if you haven't, I recommend you do, because Prime, you can typically find products cheaper elsewhere. But it's so simple and easy and convenient for you to buy it from Prime. You typically will just buy it. You don't even think about it too much. That's, this sort of relationship and behavior and commitment is what you're trying to, build with your membership plan and bring your patients closer to practice and, making it just something that they just sort of commit to and simple and easy for them to just do that and they don't think about it. This is an example, just so we're on the same page, of a membership plan. The next section, I'm going to go through results that we see with different dental practices. But so typically a dental practice will have 3 care plans. You can have 4, you can have 5, you can have 2, you can have 1, but typical is 3, 1 for children, 1 for adults, and 1 for perio patients. You design these plans, you price them, you set the subscription, you decide how much discount is for other treatment and things like that. You decide what's in hygiene. I'll just pick this one in the middle. So in this example, it's $33 a month or $396 a year. You can decide if you enable patients to pay on a monthly basis or if they have to pay up front. We, Kleer, we have practices that do both. Some will do just annual, some will do annual monthly, and so on, but it's up to you. In this example, it's 2 cleanings, 2 exams, a pano, and fluoride treatments. Again, if you don't do fluoride treatments, you keep those out. If you do 1 versus 2, you do that. If you do something else, during hygiene, you add it. So that is, you decide what that is. And then in this example, they're doing 10 to 25% discounts off of procedures. You can set those by procedure category. You can make it one flat rate across all procedures. Again, it's up to you to decide. You can do things like add family discounts and so on and so forth. But the key here is you're in control, and it enables your patients to get access to the care they want in a budget-friendly way. And it's creating this long-term mutually beneficial relationship. That's the goal of your membership plan. And what you end up creating here, and this I'll get into with the results, you create this membership club effect, we call it, where that patient feels good about taking steps towards a better oral health because they've always wanted to. They feel financially savvy, right? This is affordable. They're getting discounts off additional treatment. They feel financially savvy, just like you feel like when you're buying from Prime or some other membership or subscription plan. This trust thing is a big deal. So think about this. You're providing care directly to them. There's not some third-party discount plan or insurer in a way. It's transparent. You're showing them everything. It's simple. There's no pages to read. It's like a set of bullet points to read. And there's no barriers. There's no deductibles or annual maximums or waiting periods or pre-approvals. All that goes away. And I know that's what you want, right, as a dental practice, but that's actually what your patients want as well. They value that. They want it simple. They want it direct. So it's a sort of a two-way sort of mutual relationship there that, you know, builds into the confidence from the patient and trust from the patient. So I'm going to go through these pretty quickly, but we basically offer practices on our platform a review of the practice management data whenever they'd like. We typically wait about 6 months, but you'll see in these studies, or I think they're all at least a year of once they implement our membership plan, you wait 12 months and then measure how it's doing. And this crosses, we have practices in thousands of practices across all the states. This practices all, you know, all types of practices are in this study, from groups to independents to fee-for-service to insurance-based to pediatric. And the data was pulled from multiple places. And what we're trying to do is understand, how do membership plan patients act relative to just uninsured or uncovered patients? And what we found across, this is the average, this slide shows the averages, and I'll show some examples of specific practices in the next couple of slides, but we saw a 2x increase, a little over 2x increase in production. And this is net production, by the way, not gross, across the practices. So the blue bar is clear coverage patients, the red bar just uncovered patients. And this is for the patients that come in on an annual basis. So all the patients that came in who were uncovered, all the patients that came in who had clear coverage. And we saw about a 70% increase in hygiene across all the practices, a 2.3x increase in treatment acceptance outside of hygiene, so crowns and fillings and so on. And that translated all into that 2.1x increase in production. And what we were shocked by and amazed by is that 2x that I talked about across other industries is absolutely applicable to dental. It was almost exactly the same. Here's, you know, just some samples of different practices. What I wanted to show here is, again, different types of practices across the country and so on. And you get a range of impact here. So from 1.6x on the low end to 3.7x on the high end. And it could be a variety of reasons that, you know, drive this. I'm going to get into some examples of this 3 to 7x and why they got such a great return on theirs. But it's not like a 2x multiple, you know, every time. It ranges a little bit. First one is a practice in Ohio, insurance-based. One office, and this is for all of 2019. So they implemented back in November 18. We measured the impact of all of calendar year 2019, and close to the average, a little above the average, about 90% increase in hygiene, almost a 3x increase in treatment, and a 2.4x increase in production. So pretty straightforward, and, you know, sort of, you know, marked to the average pretty well. And this is the plan they offer. So they have a standard plan, like a child, adult, perio. They keep this thing pretty basic. You can add all kinds of things to this, like specialists and family discounts. They didn't do that. They kept it really simple. You can see it's 24, 26, or 42 a month. So really straightforward. Here's another practice, Northern California, 2 offices. Again, this is all of 2019. Again, they were about on the average, 60% on hygiene, 2.2 on treatment, 2.1 in total. And just to give you a sample, you know, they did very similar, simple plan, child, adult, perio. They did add a subscription discount for family members. So any family members added to the first membership plan will get a 5% discount off that subscription, the $45 in this case. But take a look at the pricing, right? 33, 45, 50. If you go back here, 24, 26, 42. It's pretty simple why, right? The first one's in Ohio, the second one's in Northern California. Much more expensive place, but, you know, basically pricing these things is really important, pricing them properly. And you can range the pricing depending on where you are. This is the one I wanted to show as far as the uniqueness of this one and the impact it had. So this is a Southern California practice, again, all of 2019. We actually pulled out visits for this one. So they had a 3x increase in visits for their membership plan patients versus uninsured, and a 3.7 increase in production. And look what they did. So they had the standard, but they added another plan for their seniors. And so they have an adult, older population. They have a lot of patients over 65. They created a senior club. They discounted it a little bit from their adult plan. But the net is, what they did was they opened up the time slot 1 to 3 p.m. in the afternoon for the senior club. So they took advantage of that sort of dead time they had in their practice. And what they do is the seniors come in who join this club for their care at that time. It's a little discounted, but the net is it's a really increase in production of the practice, and that's at 3 or so x increase on production side. That a lot of it was driven by the senior club. And then I'm not going to go through each one of these because I'm not going to have time. But here's a group practice, 6 offices. They had very similar sort of results, like a 2x increase. And then here's a North Carolina practice, again, 2x increase or so. And we have a bunch of those things. But so the net is, if you want to take a look at your practice, all we did here is to create a little table, just give you a reference. If you have 250 uninsured patients, based on the data I just showed you on the averages of all the practices that we measured, if they remain uncovered, they do about $146,000 of production. If they're on a membership plan, again, if we hit those averages I talked about, they do about 306. So that's $160K increase in production if you get 250 patients on your plan. So why does this happen, or how does it happen? Like, how does you end up doubling uninsured patient revenue? One is that membership club effect I talked about. So that simplicity, transparency creates loyalty and trust. So you have that in the background. You also have the patients committing to care, right? They're either paying annually up front or they're paying on a monthly basis. So they're paying for their hygiene appointments. And so what happens? They come in for them. So they come in for their reappointments. And so they come in at 2 to 3 times X what a typical uninsured patient would do come in for those reappointments. Where does treatment come from? It comes from hygiene, right? So 75% of treatment originates in hygiene. And that's, you can go out and see some studies around that. There's a bunch of studies that show that. So by getting them into the chair, getting their hygiene done, treatment comes from that. It's pretty basic, but that's why a membership plan works, is that's sort of the logic behind it. From a best practices standpoint, and I'm going to hand this over to Blake in a minute or two, I've touched on a lot of this stuff, but you want to localize it, right? Pricing, treatment protocol, whatever you feel your practice is best for your practice, you need to sort of design it to localize for your practice. Also, you need to personalize it for your patient. So you want to make sure you look at your patient demographics and those care plans align to those demographics. So if you have a lot of children across different ages, you're not going to just have one child plan. You might have 2 or 3 child plans. And we help with that. We actually have a consult where we'll go through that and help you design the plan and price it and all that stuff. You got to balance value here. So you can't overprice it where the patients stay away from it. You can't underprice it where you don't make money. So you got to find that right balance where there's value on both sides. We actually have an algorithm that does this, and it'll find the right pricing for your practice based on your fee schedule. You want full commitment. So as the dental practice leader, who's typically the dentist, you want to make sure you show your full commitment to the team and that this is important. It becomes part of something you measure and you track. And everybody understands that this is something that they need to promote to the patients and talk to the patients about. You need to train your team. You need to make sure they know how to talk about the membership plan and not sell it to patients, but just show value to the patients. You want to offer it to all your uninsured patients. Don't pick and choose. This 2x multiplier happens because there's a lot of latent opportunity in your uninsured patient base. They're not buying because they're afraid of cost. They don't have coverage. By opening that up, you're going to see a lot of treatment come from patients you didn't expect it to come from. So it's really hard to pick and choose which patients to pick and choose and give the membership plan to. So offer it everywhere. You want to maximize. You want to measure production profitability, not write-offs. You are going to have write-offs, right? You're going to give some discounts, but the impact of that increased production weighs the write-offs. So don't just measure write-offs. Make sure you understand the full picture of production and profitability. You want to automate things. You don't want your team or your patients doing a lot of manual activity. Don't give them a form to fill out. That drives patients nuts. Make it all automated. Make it work on your phone or any device they bring in. And then there's a lot of state and federal regulations you got to follow. So just make sure you've looked into those and are compliant. You probably got this from, I'm not going to spend any time on this. We have a team that helps you design, price, and promote the plan. We have the platform that enables you to manage it and offer it to your patients, for patients to buy it. Your patients have a portal to see their benefits and all that stuff and change payment methods and things like that. And then we give you all the materials you need to promote it. So I'm going to stop there. I know there's a lot of material in 20 or 25 minutes, and I'm going to hand it over to Blake Hadley, who's the president of My Social Practice.
Awesome. Thank you, Dave. Hopefully everybody can see me and hear me. I'm going to share my screen here. All right. I love that presentation. I love the idea of these membership plans, especially right now. From a marketing standpoint, we have practices come to us a lot and they want to offer some type of discount or some type of offer that they want to push out through their marketing. And a lot of times we've seen, as we do these type of discounts, the ROI on this isn't that great because it's kind of a one and done sort of thing where these people, their patients just want to come in for the discount and then they never see the patient again. So I love the idea of a membership plan because it's a retention tool as well. Not only will the person come in for a discount as the practice is showing that empathy towards them, but they also stay for a longer period of time, which is really what you're trying to achieve through your marketing. So thanks, Dave, for that presentation. So I want to talk now about once you have that plan in place, once you have a membership plan or whatever it might be in place in your practice, how can you communicate it? And especially, how can you use social media marketing to show empathy and communicate that message? So that's what I'm going to speak about. My social practice, we're a social media marketing agency specifically for dental practices. And we've developed a 5-phase strategy for you to reopen your practice that tells you exactly what you should be focusing on in every single phase. So from the point of quarantine, which many of you are in now, to about to open your practice, to after you open your practice, what topics should you be focusing on as you market and use social media? So you can download this worksheet. I'm going to this URL here. If you go to info.mysocialpractice.com/worksheet, you can download this for free and start implementing it in your practice. But today I want to focus specifically on the phase right after you open, which is our expertise and empathy phase. And I want to focus even more on this idea of empathy in your marketing. So Antonio Damasio, he's a well-known neuroscientist. He said this: "We are not thinking machines that feel, rather we are feeling machines that think." So his philosophy was that every single decision that we make as human beings is based on emotion, something that we feel first. And we feel first, and then we think second, right? So there's 2 different ways to market to people based on this. There's the idea of sympathy-based marketing, and then there's the idea of empathy-based marketing. Sympathy-based marketing is based on solving a problem based on how people think, okay? And empathy-based marketing, excuse me, is solving a problem based on how people feel. So let's talk first about how people think and what people are thinking right now as they're sitting at home in quarantine. They're thinking, I really need to see the dentist after quarantine, right? Maybe they have a toothache, or it's just been a while since they've gone, or been a while since they've taken their family. So that's the thought going through their head. So the initial reaction to that thought, and this is what a lot of dental practices do, they say, okay, people need to go back to the dentist. Let's just throw a bunch of ads at them and try to hit them, wherever their need is. Let's try to figure out a way to get them in our office. So they'll do stuff like this, right? With the stock image, the normal stock image of the smiling family on it. Only $59 for adults complete checkup, or get your smile back and confidence back. It's the same stuff that we see all the time. There's these discounts that are thrown at these type of people, and hopefully something sticks, right? Now let's talk about how people are feeling right now. What are your patients feeling, especially at this time? And there's 2 main feelings, and Dave kind of touched on these. There's a financial stress. A lot of people are feeling financial stress. And there's also a safety anxiety. People are nervous to leave their homes. People are nervous to go to the dentist, right? And if they weren't nervous before and had that anxiety, they're even maybe more nervous now because of everything that they're seeing in the news. So how do we react to those feelings? And there's so many great ways on social media that we can show empathy that will help people resolve those feelings that they're feeling and help people directly. And I'm going to talk a little bit more about these examples in a little bit. So empathy-based marketing is walking in your patient's shoes to understand their motivations. You don't want to just think like the patient, you want to be the patient. You want to understand how they feel. So really getting in their shoes and thinking about how your patient feels. Brene Brown, she's a well-known author and speaker. She said, empathy fuels connection and sympathy drives disconnection. So think connection before conversion when you're thinking about your marketing right now. How can you connect with your patients first and then convert them to be lifelong patients? So this is me and my wife and my daughter, and we just recently found out that we're going to be parents to twins. So we're gonna have 3 kids in about 5 months from now. We're gonna have 3 kids under the age of 2, which is crazy, something completely unexpected, but we're excited, nervous, overwhelmed, kind of all those feelings together. So this is gonna be us in about 5 months, the 3 rear-facing car seats in the back there. So we don't have a car right now that will accommodate this, you could put the 3 car seats in the middle. So right now we've been looking for a car that can fit this need. And we've been looking at the Volkswagen. There's a Volkswagen Atlas that we've been looking at a lot because it has 3 connections in the middle for the car seats. And we've also been looking at different options. So I want to show you 2 commercials that we've seen as we have been trying to make this decision. So I want you to watch these commercials, and then based on the feelings that I'm feeling, I want you to think about which one appealed to us the most.
You get a lifetime warranty. Lifetime, no charge.
At strong Volkswagen.
Plus, save thousands with stronger pricing at strongvw.com. New Jetta, Passat, Tiguan, and more. Just go to strongvw.com and unlock the stronger price.
Thousands less than you'd ever expect.
Okay, I have no idea where that voice comes from or why, but that was the first one. And here's the second one.
This is our home. We've never seen it look quite like this, but there's no mistaking it.
It's filled with the schools that taught us to read, the factories that taught us to work, and the people that taught us everything in between.
And it's our job to care for it.
Because the best people to fight for our communities are those in them.
So if you recently bought a Volkswagen and worry about your next payment,
or if you were planning on buying and are concerned it's not the right time,
we're here to help with the community-driven promise.
All right, so based on what I told you about how we're feeling, overwhelmed, financial stress, I mean, with all this, the pandemic happening, I'm a business owner, and it hasn't been easy like it hasn't been for many of you. It's been a tough time. I'm trying to make this decision right now. Which one do you think appealed to me? One appealed to my thoughts, right? And one appealed to my feelings. And we actually ended up buying a Atlas just last week, and are super happy with it. So how can you do this as a dental practice? Okay, so we recently launched a campaign called the We Still Care campaign. And the idea behind it was that practices weren't doing dental care like they used to, but there were still ways that you could care for your patients and ways that you can contribute and care for your community. So if you go to mysocialpractice.com/we-still-care, you can put your email address in there, and we'll send you a whole bunch of ideas every day of things that you can do to show that you care. And we had hundreds of practices post different ideas on their social media accounts. And here were some of the ideas, just to go through them quickly. The idea of making it personal. Turning your camera around, talking to your patients, just telling them that you're there for them, that you get through this together, that they, showing your face and showing that you're sincere went a long way. And social media was really one of the only places that you could do that right now. Show your team unity. Take photos of your team on a Zoom call and talk about what you're doing to prepare to reopen. Be relatable. We had practices do TikTok videos and just post those, just things they're doing at home. And they started these conversations with their patients and with the community of just about, not even about dentistry, but about fun things that they were doing. Share your talents. This practice here, every Sunday night, they went live on Facebook and they just shared beautiful classical music with their patient base and with the community. They had 99 comments, 894 views, tons of reactions. It was great for them. And share dental advice. You can still talk about dentistry while you're at home. Just sharing little tips and tricks through video went a long way. And then be optimistic. This is a great idea of just taking a picture of holding a word, putting all the words together that created a sentence, an optimistic message. And again, this kind of brought hope and people starting conversations with the practice. As well, with this, you can donate, you can do charitable things and give to your community. We have practices that donated supplies to the local hospital. I love this comment here that was made on this. It says, wow, really cool. He's my dentist and just got a lifetime of loyalty. So again, that emotional connection of seeing you give and helping brought a lifetime of loyalty to this patient. Support local restaurants and stores. This practice went to stores and took a selfie with them and just tried to support them as much as they could. Highlight team members that are volunteering. If you have a team member doing some good in the community, like making masks, highlight that. Treat healthcare workers to lunch. This was a fun idea that Trader Point Dental did. They bought lunch for their local healthcare workers on the front line. And then this idea of curbside dental supplies. This dental practice and orthodontic practice, they offered elastics or toothbrushes and toothpaste outside during quarantine, so people didn't have to go to the stores and they could just pick it up for free at the practice. So those were all ideas during quarantine that people were doing. And now let's talk about as you open your practice. How are people feeling? Going back to what I talked about, this financial stress and this safety anxiety that people have. So what can you do on social media to resolve these feelings? This is one practice that they just did a virtual walkthrough of the patient experience. And I just want to show the first part of this video here.
Hey Frost family, it's Dr. Nichols. We're so excited to see you for your next appointment. We've missed you so much. We wanted to take you through some of the extra precautions that we're taking this week and in coming weeks to ensure the safety of you, your family, and our team. So I'm gonna be the patient. We're gonna walk through the office and let's see what's going on. All right. Hey Caitlin, how's it going?
Hi, good. How are you, Dr. Nichols?
So awesome. I'm just so excited for my adjustment today.
That's good. We're excited for you to be here. So come on over here. We're going to have you first use some hand sanitizer.
Okay, I can do that. Thank you so much.
You're welcome. Aaron, do you mind checking Dr. Nichols in?
Absolutely. Thanks, Aaron.
Thank you. And then we're going to have you sign this consent form. It asks if you are over 100 degrees, if you have traveled, anything like that. So if you can have that filled out, and while you're doing that, I'm going to check your temperature if that's okay.
Yep, sounds good.
All right, so obviously there might be different regulations, and this was actually released. They opened fairly early in Arizona, and so you might have different regulations, but the idea behind this is awesome, I think, to be able to for a patient to be able to see what to expect when they come to your office. That will give so much relief to that anxiety that they have, because they'll know exactly what to expect, and they'll see that you're taking the measures necessary to keep them safe. I show the behind the scenes of cleaning your office.
Sterilization room. After every appointment, when your instruments come back here, we take your dirty instruments and we put them in our ultrasonic bath here. After they're in the ultrasonic bath, this gets turned on, they shake in there.
Like a jacuzzi, yeah.
It's a jacuzzi. It shakes everything, it cleans all of the debris off of the instruments. We clean the trays down with the cavity wipes, as well as we do the stations like she told you. After these shake in the ultrasonic, then they get bagged up into sterilization pouches, and then the sterilization pouches go into our autoclave, and the autoclave cooks them and kills any bacteria that could be on them.
Oh, awesome.
And then once they come out.
So you get the idea. This is stuff that you have been doing for years, right? That you already do, but patients don't get to see those behind the scenes. Now it's important to show those behind the scenes so that they know what you're doing to keep everything clean and sanitary for them. Describe your protocols, your new protocols for keeping patients and team members safe. This is a small clip from this video that just shows that this doctor has thought of everything.
We've done some really cool stuff over the last month and a half, instead of just sitting home and watching Netflix, which we have done a certain amount. But we've incorporated the way patients are going to flow through this office. we've gone through protocols extending patient appointments so that we can have extended time cleaning the rooms. We've put up guards at the front desk so that our front desk staff feels safer. We've put HEPA filtration systems in around the office. We've ordered industrial hospital strength HEPA filters to be placed inside the office, and we're looking at creating a negative pressure environment through our ductwork so that the whole building is like a hospital.
All right, so like I said, you can tell he's thought of everything, and that trust that comes from that, if a patient were to watch that, is so important. If you don't feel like doing a video or you're not comfortable on video, I would encourage you to do video if you can, or try it. I know at first it might be a little uncomfortable, but patients love that personal connection through video. But you can also use photos like this. This is a photo of showing the HEPA filters, a photo showing the new PPE that you will be wearing. Explain what you're going to be wearing. I think this is going to come to a shock for many when they come to the office and maybe you're dressed like this. Explain why you're wearing this equipment and this gear, and go through every item. Social media is a great place to do that. Address scheduling confusion. I want to show this video real quick.
Hey everybody, got some great news. We are starting back up May 8th, and that's based off of Governor Cooper's announcement as of yesterday. So we are super excited. It's been too long. We're really anxious to get back, just like you guys are. For those of you that have appointments currently scheduled May 4th through May 7th, someone from our office is going to be reaching out to you in the near future, most likely through text message, to cancel those appointments. And then starting on May 8th, we're going to start seeing patients again. Now we have to kind of prioritize how we're seeing patients because there are a lot of appointments to make up for. What we'll do is we're going to start by seeing emergencies, kind of first, and those of you that have been waiting the longest. So those of you that had appointments that were canceled dating back to the end of March will be the ones that will receive appointments first, and then we'll kind of work our way up to the most recent cancellations from there. We appreciate everybody's patience as we get all this kind of worked out, and Dr. Rankin is going to kind of go through with you guys some of the exciting changes here at the office.
All right, so what does he go through at this point? I think a lot of patients are going to be confused about what's going to happen. I think about actually my experience. I had an appointment during quarantine that was canceled, and one of the first things I might do to find out what's happening, because I haven't heard yet from my dental practice what's going on, I might go to their Facebook page first to find out what their plan is. So tell your patients your tentative reopening date or your reopening date. Tell them how soon cancel appointments will be rescheduled. How will they be contacted? Are you going to send them text messages? Are you going to call them? Are you going to email them? How are you going to contact them? What are your first priority appointments? Are you going to be doing the canceled appointments first or the emergency appointments first? What if someone just wants to get a teeth whitening? How long should they expect to wait to get in for that? And then emphasize urgency to schedule. I think in all your posts, tell people, make sure to schedule as soon as possible so we can get you on our schedule, because things are crazy right now. We're really busy trying to catch up from everything that's happened. Building trust. A video is a great way to build trust, and social media is a great way to do that. So let me show you this video real quick.
Hi, I'm Dr. David Bradley, coming to you from Lake Oconee Dentistry. I know a lot of you, but not quite all of you. So on behalf of all of our doctors and team, I just wanted to give you a quick update on where we are as far as opening the practice. Earlier this week, Governor Kemp gave permission for dental offices to resume operation again. But I want to fill you in a little bit on why we're just not quite ready for that yet. We think it's a little bit too early. So what's going on? Like every other business, healthcare-wise or other in the planet right now, we're all trying to make sure that when we can open, that your safety and the safety of our team is always the biggest priority. We want to make sure that we've got all of our T's crossed and I's dotted. So what we're working on, we've ordered a lot of protective equipment for our team. That protects our team, but it also protects you as well. A lot of that's on back order. We don't have it in our hands yet. By not having it in our hands, it's not safe to open. We've ordered other things for the facility. Just for our whole facility, we've ordered air scrubbers and sterilizers and things for the air that we all come in contact with. Those are not here and they're not installed yet. We also have lack of other protocols and things that are in place that, quite honestly, our profession hasn't even defined and passed down to us yet. So with certain things, we can't do them because we don't really know the safe way to do that procedure at this time. We're working on all of that stuff. So we want to thank those of you that we've had to inconvenience by moving around your appointments. And we're expanding our hours. We're doing some different things to where we'll have more opportunity to get you back in. And we will be contacting you as soon as we can when we know we can get you back on the schedule. Some others that are out there with treatment that's in progress, maybe you have a temporary crown that's in there right now, you are actually going to be contacted sooner, and we will get you in as quickly as we possibly can to finish your treatment and make sure that those areas, as soon as it's safe, we've got you under control. So we'll be in touch with you over the next couple of weeks. We thank you for your patience. We thank you for supporting us, and we look forward to seeing you soon. Thanks.
So this is one of my favorite videos about all this, and I think it really builds trust. And here's some of the reasons. He looks very buttoned down and prepared, very professional. He's confident in what's going on. He explains these extra efforts that their team is making right now, that they're going the extra mile to extend their hours, and they really want to do everything they can to make sure that their patients are safe. And then the biggest thing that I thought is so interesting is, you would think, to build trust, he needs to say that he's completely prepared and they're ready to take patients, but that's not the case, right? What does he say? That they're not quite ready, that they don't have all the equipment yet. They're not, even though the governor said that they can open their practice, they're not quite ready yet. And this transparency is so key in social media. It's what builds trust with your patients. We've seen companies that try to go around this and not be transparent with what they're doing, and it always comes back to bite them. People right now expect transparency, and if you're not ready to open, just be open with them and tell them what's going on, and it will build more trust for the future as they come into your office. It's something that Lake Oconee Dentistry has really built in the culture of their practice. Another thing is listening, understanding, and giving is a great way to show empathy. Dedicate posts just to questions and concerns that are happening right now. On Instagram stories, you can post poll questions, and if you can ask your patients how they feel about coming to their office, into your office, if they have any anxiety. And if they say they do have anxiety, this is an opportunity for you to reach out to them directly through direct messages on Instagram or Facebook, and talk to them about their concerns and resolve those concerns that they're having. Promote these flexible payment or membership plans like Dave talked about. This is just a post that somebody made on their personal profile that said, anyone know dentists that take payment plans? I need my wisdom teeth out so bad, they're getting infected, and I don't have $2,000 to dish out at one time. And people responded, her friends responded at different practices that are offering membership plans or different type of payment plans. So this is just really shows how people are feeling right now. They need dental work, but they don't know if they're ready to dish out that amount of money. Kleer, as Dave talked about, is a great solution. I already mentioned this, but these are type of posts about this that you'll want to maybe boost to your local community. These are some marketing materials that we developed for Kleer, some different signs and things that your team members can hold. But something great that we've seen is actually team members, again, just making a video talking about their membership plan, just explaining, hey, we just launched this new membership plan. This is how it works. Please take advantage of it right now in your practice. And again, this personal video goes a long ways. And then my last idea is run a charitable giveaway. Social media is a great place to run these giveaways that will help build your following and build your reach. But it also shows that you're caring for your community. This was a practice that ran a Mother's Day giveaway. So they had people nominate a mother in their community that's doing, either having a hard time or has done some great things. And they would write the story of the mother and they'd nominate her. And then this practice picked a couple, I don't know if they picked 1 or 2 winners to give a smile makeover to. So this doesn't have to be a smile makeover. This could be just dental treatment. Maybe you give some free dental treatment to someone in your community that's having a hard time during this kind of financial struggle that a lot of people are having. So again, we have this worksheet that covers all these ideas and more different things that you can do, and check them off as you're doing them. And anywhere, any phase that you're at, you can get started, whether you're still in quarantine or you've already opened your office, there's ideas for you. And so if you go to info.mysocialpractice.com/worksheet, you can download that. And just really quick about My Social Practice, we really do want to help practices right now. And if you sign up on our service, we have some really great bundled deals right now. We'll assign you a marketing consultant and we'll customize the solution for your practice needs. We set you up on we send you a calendar of what to post on different days, so you never have to think about what to post. We coach you and train you about how to post it, how to write your caption, how to boost it to your local audience, and really so you don't have to worry about this. We know you have enough to worry about right now. We also even send you a box of ideas, props and signs and fun things that you can implement in your practice for right now or into the future. So again, you never have to worry about what to post. We also provide different, we provide even more than that. We do websites, we do SEO, we help you with reviews, whatever it is, we can help solve your marketing needs. So that's all I have. This is kind of the last slide, and Dave's going to kind of talk real quick about his offer, and then we'll turn it over to some questions.
All right. Thanks, Blake. That was excellent. Yeah, just on Kleer, we have a free ebook out there. It goes through a lot of the data I went through, and if you want to get a look at that and use it in your practice, please do. It's at kleer.com/ebooks. You also can schedule if you want to get started and learn more about Kleer and how we implement. You can do a live online demo at kleer.com, and everything's free. You don't pay anything until you actually sell a membership to a patient. So all the way up to the consult, the design, the pricing, all the materials, the marketing materials we provide is all free. Like I said, we don't get paid until you actually sell a membership. So, and it can all be done virtually, and you get going right away. So let me then hand it over to Becky for Q&A.
All right, thanks, Dave. Thanks, Blake. Great presentation. We do have a couple questions that came through, and I see that we're coming up to the top of the hour, but if you guys are good with it, we can hang on and answer a couple questions.
Yeah.
Sure.
Awesome. All right. So again, to everyone who's on the line, feel free to send your questions through the Q&A feature or the chat feature. I'll be picking them up and asking Dave and Blake your questions. One that came through is on membership plans around monthly payments. And Dave, does it make sense to offer a monthly payment plan?
So the answer to that question is it depends on your patient base. So if you have some younger patients, millennials, absolutely you want to offer a monthly payment plan. And we see when a millennial's offered a monthly plan versus annual plan, if you're offering both, which a lot of practices do, about 80% millennials will pick the monthly plan. And it's the exact opposite, by the way, when you go to 60 plus demographic, they will typically pick a annual upfront payment. And given where we are with COVID and the uncertainty and the insecurity and also some job losses, we're really encouraging practices to offer monthly, just for not just millennials, but across the board, just to make it easier for a patient to budget for their care.
Great. And Blake, this one's for you. How do we get some of those social media cards?
Oh, the signs maybe they're asking about?
I think that is.
Oh, yeah. So yeah, the signs come as part of our service. We send them out every 2 months with that box that we send out of all those props and ideas. You can go to our site. There's a tab at the top that says free stuff. And I believe there's different things in there where you can download some signs and print them at home. I know we actually have created some for Kleer as well that you can download and print. I don't know if that link is off Kleer's site or where that might be, but you could probably even search it at Kleer marketing, a marketing packet or something. You should probably find it. But yes, the signs have been awesome. Our practices love using those signs. It's a fun way to take a photo. Great. And then using those signs, should we be boosting
our posts on Facebook?
Yes, definitely. So Facebook is a pay-to-play model still. If you post things without putting a little bit of money into it, it might go to a small amount of your audience. But if you boost those posts, even if it's $3 to $5 into that post, and boost it to your local community, there's ways that you can set your geographic area that you want to boost those posts to. It will go a lot further. And then if you start getting likes and comments with those boosts, put a little bit more money into it. And it shows that that's engaging content. So yes, we definitely recommend that you boost posts.
Great. And I think this question is going back to Dave on monthly payment plans. What is the payment default rate for monthly payment plans?
So yeah, it's a good question. So we have a number of practices will be nervous about offering monthly plans. And I talked about demographics and sort of why you'd want to offer a monthly plan. What we do at Kleer to manage default rates is we actually charge 3 months up front. So if they select monthly payments, we take those first 3 months, it's $30 a month, we'll take $90 up front. And then the following, come up to the 4th month, up to the 12th month, we'll take a monthly $30 each month. So what we do is we actually do a check on the back end before we accept the card and make the transaction. And then we also do a lot of notifications to the patients and to the practice about payments. The net is we manage our default rate on the monthly plan side to 1.5%. So it's very low. And we actually have practices that are quite a bit below that. And it's just a matter of managing it and making sure, one, we do that check. And then second, if there is an issue, like somebody loses a card or they had to cancel a card or whatever, that you follow up. And then, like I said, there's automatic notifications to manage all that.
Great. And here's a question, and both of you may want to chime in on this one, I'm not sure. We have someone here who says, we are a practice in Western New York, and our county was hit very hard with cases of COVID. Our governor is stating that we haven't entered phase 1 of reopening until June 15th. We have some of the PPE, but not all we need. How can we be confident that we are giving our patients the best care when we don't feel entirely safe opening it?
Blake, I don't know if you have a quick answer to that.
Yeah, I mean, I think from the communication standpoint of telling your patients how prepared you are, I really like that example that I showed of Lake Oconee Dentistry, how they said they're kind of in your same phase, to be honest. They said, we have some equipment, but not all of it. We're not quite ready yet. And I think it's important to let your patients know that and start telling them about some of the things that you do have so far. If you have some PPE, as you guys are learning more about how to use that PPE and going through all the protocols of getting ready to open, it's okay it's good to explain those things to your patients. But yeah, I would say, I mean, I'm not an expert on practice management, but I think it is really important that you feel that your practice is prepared for this so that you can provide the best patient care before you reopen. So yeah, I guess I don't know if you have anything to add to that, Dave.
I don't. I think you nailed it. Yeah, you just, I'm all about transparency. So I think you just tell them where you are. And I think that one video you showed actually, Blake, would be a great template where the guy said, we're not, even though the state's open, we're not opening yet because of these different reasons.
Yep. Yeah, I agree.
All right, we've got another question here. Dave, I think this one's going to be for you. With Kleer membership plans, if they choose the monthly plan and pay $33 but need a crown that's $1,200, do they pay the membership fee and cost of the crown to get started, or what do they have to pay up front to get started?
Yeah, so in that example, if they join your membership plan, then let's say it's $33 a month. When they join, we'd collect the $99 and transfer that over to the practice. And then the 4th month on, they'll be charged $33. That's a separate transaction from, let's say, the crown in this example. So with the crown, now that they joined the membership plan, let's say you offered I'll just pick 15% discount for other treatment under your membership plan. So the crown procedures that are processed, you're just going to take a 15% discount off of your UCR and charge the patient, when the procedures are completed. And so it's a little bit of a separate transaction, but it's all part of the membership plan.
Great. And then also on membership plans, what is a typical subscription price for the membership plan, Dave?
Oh, yeah, I guess I never covered that. So the average across, we have thousands of practices across all 50 states, and the average is $345 a year is the subscription. The range, though, is broad. As I went through some of those examples, we have some practices that will discount. Let me just pick the adult plan rather than go through child, adult, perio, and others. So the adult plan can range from $20 a month, I think is on our the lowest end, and then all the way up. We have some practices that are $45 a month. And it depends on their geography and their patient demographics. Obviously, New York City and other metros are going to be more expensive than, let's say, Provo, Utah, or somewhere out in a rural setting.
Great, and I see one last question here. If anyone else has questions, throw them in the chat or Q&A, but this one's for Blake. Which social media platforms do you recommend dental practices focus on for marketing?
Yeah, so there's so many different platforms out there. I talked about TikTok a little bit. There's Twitter, Pinterest, right? And we have found over the years of working with practices, the 4 most important things you can focus on right now are your Facebook page, your Instagram page. So Instagram is actually growing faster than Facebook right now. And I think we'll soon be the leader in all social media. So your Instagram page and your Google My Business page. I know that that's not typically thought of as social media, but it's a really important platform to make sure you're updating and that you're responding to your reviews. It's where people search for you and that little profile that shows up on the right-hand side. So make sure that that's looking good. And then obviously your website. The website, again, it's not really social media, but it's important to have. So if anything, focus on those 4 platforms, especially right now.
Great. And I think that wraps up our questions. We went a little bit over, so thank you everyone for hanging on the line. And Blake and Dave, thank you so much for your presentation today. Again, if you have any additional questions for Kleer or My Social Practice, all that contact information is on the screen in front of you. So visit Kleer.com or mysocialpractice.com to request your demos from either organization. And everybody, again, thanks for joining us today and have a good one.
Thanks, everyone.
Thank you.